taking care of you today. How are you feeling this morning? Is there anything I can do before we begin? Today I'll be performing the Mohs surgery because of where your cancer is located. This type of surgery is the best option. Dermatologist Mr. Doctor plans to do a dermoplasty where he will remove the cancerous tissue, then reconstruct and close the wound after a pathologist analyzes the lab specimens. This will be done in a single visit and will require no inpatient care if everything goes accordingly. We will be removing the basal cell carcinoma that is on your cheek. The incision is going to be about 4 inches in length and no more than a centimeter in width. It says here on my records that you came in here because of red patches that looked somewhat like an open sore that was slightly pink. Is that correct? Those are characteristics of basal cell carcinoma. Basal cell carcinoma is an uncontrolled growth or lesion that appears on the skin. If you want to know why it's called basal cell carcinoma, it is because the cancer specifically arises from your basal cells, which line the deepest part of your epidermis. Your epidermis is your first layer of skin. Mr. Doctor is trained in Mohs surgery, pathology, and reconstructive surgery. He will first use anesthesia on the previously marked area of operation. After he uses a scalpel to remove the layer of skin, they then take the skin and put it under a microscope to see where the cancer cells are present. He will repeat this process of removing a layer and examining until the results show no sign of cancer present. This process of removing a layer of skin, examining it under a microscope, could take anywhere between 2 to 6 hours. This is because we do not know how widespread the cancer is until we go in and take a look. But do not worry too much about how long it will take because you are in great hands. Surgically, removing the basal cell carcinoma is only step one. Wound care and following discharge instructions is very important to a full recovery. Most patients are afraid of a keloid scar, which is an overgrowth of scar tissue, but do not worry. The chances of developing a keloid scar are slim to none. First thing is to be cautious when in the sun. The risk of scarring is hard to determine though because we don't know how widespread the cancer is until we go in and take a look. Fortunately, there are many ways to aid in the healing of a scar. If you would like, I can recommend some holistic remedies during our follow-up appointment. It is typical that healing occurs within 4 to 5 days after the surgery. Would Saturday the 14th at 12 p.m. work for you? Great. Thanks. I'll be right back with Mr. Doctor.